Okay, I guess we're going to go ahead and get started. First, I want to let everybody know if this is the first time you're joining us. We do ask as you have questions throughout the webinar, please post those in our chat box. We will have a question and answer session at the end of the presentation. For those of you that don't know who I am, my name is Jamie Arns. I'm the National Staffing Manager for Everest Recruiting and a very proud board member of the Florida Staffing Association and the co-director of the Orlando Social Committee. And we're excited to present this presentation to you, who was a referral from us from our partners, Howard and Robert at PEO Source. So we're excited to have Worksite HR and HealthWorks here with us today. Worksite HR offers a new healthcare plan which empowers employers to provide low-wage and part-time employees with ERISA and ACA-compliant healthcare at no cost. By using this program, staffing companies owners can save approximately $35 per month per participant. Our speaker today is Dr. John Zabosky, who has over 20 years in fintech and in staffing. He has been the CEO of Worksite HR since 2013, architecting health plans for low-income and part-time employees, with emphasis in the staffing industry. Prior to that, he ran a successful staff leasing company for nearly 20 years. Dr. Zabosky has a bachelor's and a master's from the University of Maryland, as well as an MBA from Pepperdine University and his PhD from Concordia University. Without further ado, I'm very excited to welcome Dr. John Zabosky to our presentation. I blew it the last one, I'm so sorry.
Thank you.
Thank you, John.
Thank you, Jamie. Good afternoon, everyone. I am John Zabosky. I'm the CEO of Worksite HR, and today's topic is going to be no-cost healthcare, too good not to be true. We're presenting a new alternative approach to healthcare that's supporting temporary workers and giving business owner margins a big boost, especially in the staffing industry. So the question that we'll lead with is, why is no-cost healthcare so important to the staffing industry right now? Staffing agencies are playing pivotal roles in adjusting workers to the employment landscape. Of course, this landscape has been undeniably impacted by the COVID pandemic. But staffing agencies are now continuing to place workers in roles based on their skill sets and availability that include new types of positions. We've got contract tracers, we've got social distancing coaches. All these positions have emerged, as well as we still have the same positions that are in high demand, such as the regular healthcare workers. Now, we know as staffing owners that these roles are often filled in the hospitals, in the clinics, everywhere by temporary workers, and these temporary workers may or most often may not have access to health insurance. Now, we have additional challenges that face temp workers and staffing agencies, but it's the more traditional, old school, and that's our margins. We know that as a staffing agency, everything revolves around our margins. So from a cost perspective, the healthcare plans out there now that exist are so incredibly expensive. They're incredibly expensive for the staffing agency, and they're incredibly expensive for the employee. Think about an employee who makes $15 an hour, maybe even $20 an hour. That employee is paying at least $130 a month, even with the safe harbor, for their employee-only premium. If they want to add a dependent, such as a child or a spouse, which in most cases the agency is not going to cover at all, now they're looking at tripling or quadrupling the premium that they're paying. So due to pricing, these policies and programs limit the number of employees who are able to receive access to healthcare, and in turn, vital and crucial medical assistance. There needs to be a fundamental change in the United States healthcare system that enables staffing agencies to feel confident that the employees they place in temp positions, whether they're low wage or part-time, will have access to real healthcare. The health and well-being of all employees shouldn't be a burden to us or really any company in any industry, but especially for staffing agency especially for us staffing agencies who are placing many workers in new and high in-demand roles as a result of the COVID pandemic. The future of healthcare in the US is going to fundamentally change. There's no doubt about it. The staffing industry has the opportunity to lead the way. The health and wellness of employees should be a priority, and all employees should have access to healthcare. Staffing agencies need to consider a new type of healthcare plan, one that has the ability to empower employers to provide low-wage and part-time employees with ERISA and ACA compliant healthcare, and most importantly, do it at no cost. Create a sense of relief for worried employees. There are two models for this no-cost healthcare. You may be familiar with some of them. The first is the wrong way. It's called a 105B reimbursement plan. The second is the right way, a tax-free charitable contribution plan from a certified nonprofit. I'm going to give you an example of how these programs work and how you can compare the programs. On the left column, in the left column, you see the 105B reimbursement plan, and in the right, you see our HealthWorks plan, which is a plan from a charitable nonprofit. Let's look at the benefits first. The benefits of a 105B reimbursement program typically are centered around indemnity product payouts, such as accident plans and critical illness plans, which they often tell you are non-taxable. Now, they may include a minimum essential care plan in there, but the payouts themselves, or what they call the reimbursements, come from the indemnity products. If you look at the HealthWorks plan, the HealthWorks program contains Section 125 pre-tax benefits, definitely minimum essential care, which includes both preventative and sick visits to doctors, prescription benefits, telehealth benefits, not just for the employee, but for the entire family, and wellness benefits. So how are they no cost? Well, employees in the 105B reimbursement program receive reimbursements if they get sick. All right. The problem is that these reimbursements are taxable. So anything you get, it's similar to an AFLAC plan. Any reimbursement you get from that indemnity product is going to be taxable. However, in the nonprofit program, lower wage employees receive non-taxable donations towards their premiums from, and this is very important, the nonprofit has to be a 501c3. So it has to have been certified by the Internal Revenue Service it picks a charitable class, which in our case are lower wage employees, and they have to have a specific mission, in which our mission is to subsidize health and wellness programs for that charitable class. In other words, low wage workers, okay? Now, who's eligible for these programs? Well, in the 105B, employees have to use a service to get a reimbursement.
Hey, John.
Yes.
Your page didn't flip over to the new slide.
It did not?
No, it's still looking at the wrong way.
No.
I'm sorry.
Okay, no, thank you for letting me know. Trying to, got it. So I'll have to remember to do a new share every time I do that.
Yeah, sorry about that.
How about now?
Perfect, thank you.
All right, I'm sorry, everybody. First time doing this on a Zoom. But if you can look back through what I just mentioned, we're now up to, I'll repeat eligibility and the participation requirements for the 105B. What I was saying was that employees have to use the services in order to get a reimbursement. So it's kind of funny because you think in order to get a reimbursement, they have to get sick, all right? But in the HealthWorks program, there is no participation requirement, which causes us to always ask the question, what kind of healthcare plan requires you to get sick? So now we're going to get down to one of the most important parts, and this is the compliance area between the 105B programs and the nonprofit programs. The IRS has issued several memorandums addressing the taxability of these 105B reimbursement programs and the illegality of them. So beware of any program out there that wants to offer a 105B reimbursement to employees, and it contains indemnity products too. All right. The HealthWorks program, which is the nonprofit program, is a standard ERISA plan. It follows the same rules and procedures established in 1974 by the Department of Labor. And let me show you the seriousness of this. I'm going to bring up an IRS memorandum. And Jamie, can you see the memorandum on the screen? All right, this is very important. If you guys want to do some further research, because I can't go through all 5 pages of this, but there's a number there, 2017-03-013. If you guys just Google that, you can see how serious the IRS is taking these fixed indemnity reimbursement programs. So just beware on those. All right. Any type of program that's going to do a credit back to an employee has got to come from a nonprofit. It's the only legal way. All right. All right, Jamie, I may need your help here because I'm going to switch again.
I'm here to help.
Oh, okay.
Yep,
So,
I
did it come up? No, is it still
can
showing
see
the
that.
same?
Yes, yes.
Okay, so we're good. All right. All right. So hopefully now you can see a screen in front of you that starts with using HealthWorks, steps to put you on the path to healthier living. No, no? Okay. All right. So now what I'm going to do is now we've kind of I've laid the foundation and given you the background for why we need free healthcare in the United States and why the staffing industry can lead the way. I've also given you a little sneak peek at the right way to do it and the wrong way to do it and what to beware of out there. So now I'm going to tell you about the program. We're going to look at the actual health program itself, what it contains, and then we're going to talk a little bit about how we make it no cost. All right. So the HealthWorks program starts off with minimum essential care. And that minimum essential care includes preventative visits of items such as just an annual checkup, well woman visits, so forth. Now for those, just like a typical minimum essential or MEC plan, there's no copay and there's no deductible. All right. What our plan also includes are sick visits. All right. So a sick visit to a doctor just means, just as it sounds, a person gets sick, they go to the doctor. Their child gets sick, they take them to the doctor. There is no deductible on our plans. There is only a small copay. For general practitioner visits, there's only a $20 copay. And for specialist visits, there's only a $40 copay. There is no requirement to get a referral from a general practitioner to a specialist to see the specialist. Another great thing is that our program is HRX open access, and that means that any doctor who accepts Medicare will accept our program. So pretty much any doctor who your employees are currently seeing is going to accept our program. All right. Now this minimum essential care part of our program also includes prescription discounts, because we work with GoodRx to get those 70 to 80% prescription discounts, and also discounts on labs and imaging as well. All right. The second part of the program is what we call health risk assessment. And health risk assessment is really just a fancy term for gathering information, health information about the employee, so that our doctors can come up with the third rung, which is chronic condition management and wellness coaching. So what our doctors will do is they'll put together a personalized program for every employee who completes a health risk assessment. And in fact, we'll even go another step. And if in your company you have a large number of employees that have a specific condition, could be high blood pressure, or could be something so simple as you got a lot of people who want to stop smoking. We can do a smoking cessation program, and we'll do it as a group. So that way the employee is not just getting one-on-one, but they're also now part of a group. And a lot of times being part of that group helps them a bit. The fourth rung, and really some consider the most important part in today's age, is the family telehealth membership. All right. Our telehealth program is no copay, no deductible. It's unlimited, and it is not just for the employee, it is for their entire family. All right. So whether it's a child, a spouse, the entire family is covered, no copay, no deductible for the telehealth. And remember, on telehealth, these doctors can write prescriptions, they can offer diagnosis. Also in our program, our software contains complete health records information, so that can all be stored there. And we actually, I feel bad because we're using Zoom right now, but we actually have our own component in the Teladoc international system that rivals Zoom. So in other words, you can have a video chat with your doctor, and it's all secured, it's all HIPAA compliant as well. All right. And that is the basis of the program. So what I'm gonna, one other thing I do want to mention to you, and again, I may need your help, Jamie, as I go over to this. Did the slide change?
Not yet. There it goes. Yes.
You got it? Okay. All right.
Yep.
This is really important. And as staffing companies, we know that we have a lot of workers that their hours change from week to week. All right. And generally a program such as the HealthWorks program requires an employee work at least 20 hours. Okay. However, for those employees who do not work 20 hours or do not average 20 hours a week, they are still going to get access to healthcare. They are still going to get free telehealth, and they're going to get free wellness. The only component that they won't qualify for is the minimum essential care component. Okay. But they can still call doctors, they can still get prescriptions and diagnosis using our telehealth platform, and they can still get access to the wellness, the health risk assessment, and the chronic condition management. All right. So basically, every employee that you have, whether they work 30 hours, 40 hours, or they work 5 hours, will have access in one way or another, in one form or another, to the HealthWorks program. Okay. Now the final slide that I want to show you guys, I'm trying to tab over to it. There we go. Okay. The slide in front of you now basically goes over the logistics of the program, because everybody always wants to know, okay, yes, thanks, John, you've told me that it's no cost, but how does this actually work? I mean, how does it happen? What are the logistics? And it's actually pretty simple. Our program, and I'll explain it to you, I'll give you kind of an overview of how it works, and then I'll give you an example to make it really easy to understand. Our program is a Section 125 program, right? So it's pre-tax, all right? So there's a premium payment by the employer, or a collection by the employer, and then the employer pays us just as they would pay Anthem, right? Because in this case, we're what's called the third-party administrator, all right? So we're going to collect the premiums from the employer, who will deduct them from the employee's check, just like if it was an Anthem or Cigna plan, all right? Once the third-party administrator, receives the premium payments, what we do is we go ahead and pay all of our vendors too. One of them is the nonprofit, all right? The nonprofit we pay for, the nonprofit in our case takes care of all the wellness, and it pays for the telehealth doctors, all right? But what that nonprofit does at that point is it follows its mission. And remember, its mission is to subsidize health and wellness programs for lower income employees. So that nonprofit will send a large chunk of the premium back to the employee through the employer. Okay, so they send the money back to the employer, and then the employer simply distributes the money on the employee's check on that same payroll. Okay, so that way the employee is never out any of the money that they were deducted for the premium. All right, let me give you an example now. Let's say you have an employee that makes $1,000 a week. Okay, I'm using rough numbers. I realize temporary employees don't all make $1,000 a week, but they're taxed on that entire $1,000. Okay, but with a Section 125 program, let's say there's a deduction of $200. Now they're only taxed on $800 of that gross payment. Okay, that'll usually work out to about a $30 tax differential or tax savings. All right, so if there was a $200 deduction and there's a $30 tax savings, now the employee is out $170 for their premium payment. But what happens is remember, the subsidy from that nonprofit, the tax-free donation, is about $180. All right. So the tax-free donation comes back to the employee on the check. The employee now has $210, which is $10 more on their check net pay than they had prior to being part of the HealthWorks program. So not only did they get a little raise, all right, they also got free healthcare for them and their entire family when you include the telehealth. All right. So the employer, remember, is going to have a savings as well, because this is a Section 125 program. All right. The average savings for the employee total is about $60 a month per participant. I'm sorry, the average savings for the employer is about $60 a month per participant, because the employee saves $15 a week on average in their Social Security and Medicare. Because remember, it's a shared tax. So if the employee is saving $15 in Social Security and Medicare a week, so is the employer. All right. So that's about $60 a month if we're looking at it weekly, and that's about the average. Right. There has to be a way, of course, that Extension Health, a nonprofit, stays in business. All right. So what the nonprofit does is we bill the employer $30 per participant per month. All right. At the end of the month, the employer has saved $60. They'll get charged $30, and they'll net out about $30. Sometimes it's a little bit more. Okay. So if you have 1,000 employees on the program, you are literally going to save about $30,000 a month in payroll taxes. Right. This is why, if a lot of you will remember, the president wanted to cut back and drastically reduce payroll taxes. Well, one of the big policy reasons for that was because obviously the administration can see the need for healthcare in the United States is going to boom because of the COVID pandemic. All right. He wasn't successful at that. However, our program jumps in and takes the place of that by offering the free healthcare using those same payroll tax dollars, using the Section 125 program in a way that it should be used. All right. So I think I have confused everyone enough with the type of program. It's a new offering that's out there, and I'm sure there are going to be a lot of questions. So I think 30 minutes is long enough for me to talk, and I will be happy to answer any questions the participants have.
Great. If everybody could add any of their questions that they have in the chat box, we'll be able to sure to get those answered for you. John, one question I had for you is if we had participants that necessarily, can one participant participate in one thing versus another participate in our healthcare?
Yes, actually, we have a lot of members who keep both their major medical as well as participate in our program. A lot of them times they'll have the major medical program and it'll have a high deductible, and they would prefer to use our program for the doctor visits so they don't have to pay the deductible portion of it.
Okay, perfect.
Actually, I mean, I'll address it. There's another question too that we often get, Jamie, is what if I have a state program, like a Medi-Cal program, we call it California, or Medicaid.
Mm-hmm.
You can also use it with the Medicaid programs. All right, the only thing that we cannot use it with and combine it with is Medicare. So if an employee is 64 or over and they're on that Medicare program, they can't combine the programs, but everything else they can.
Okay, that makes them not eligible?
It would make them, yeah. What happens is that because that Medicare program is federally subsidized, they could potentially lose their subsidy on the Medicare program if they're part of any other program, not just ours,
okay,
but any other program.
Okay. We have a question from Karen who says, can you reconfirm that the employee has access to all of the same doctors that would be a traditional healthcare program? Yes,
absolutely, and probably more, Karen, because typically in a major medical program, you might have out here in California, Kaiser is very, very popular, but it's a small network. But sometimes, even with Cigna or Anthem and the Blues, they have reduced networks. So there's always that out-of-network fee, or what's the out-of-network fee and the in-network fee we have? It's only one with us.
Okay. And then is there a minimum participation requirement or maximums? Wages and all that partakes into that part of it.
Yeah, there's no real wage maximum. We have certain regulations that we have to abide by as a company as a whole, but as far as clients, there's not. There is a minimum participation because this is a self-funded program. most states require that for an employer to be eligible for a self-funded program, that they have 50 full-time eligibles or more. So that's typically the size of most of the clients that we have typically range in the 200 to 300 up to several thousand. However, as long as you have 50 full-time eligibles, you will be eligible.
And does this work across multiple states? So it
Yes.
works here versus California and all that? Okay.
Yes, we're in all states.
Okay. And then Jody is asking, being self-insured on your major medical, do you have to be concerned about funding for your plan from team members, leaving it for the HealthWorks program, especially if have young invincible workers? At least that is their mindset. You've done staffing, you know.
That's actually a great question. Okay, because remember, this is not major medical. All right, it does not include hospitalization. Okay, so if you haven't, and remember, this program is geared towards folks who typically cannot afford major medical, but we want to be able to get them something. We want to be able to get that demographic something so that they can stay healthy. If you have employees, all right, who get sick a lot or might be, have pre-existing conditions and are going to need hospitalization or think they need hospitalization, they should have that program in conjunction with this one, just in case.
And then Karen says, of the 50 FTEs, do you have to have a minimum employees? With MEC, it's usually 5 employees.
You mean
full-time employees? Yeah. Sorry.
So she has 50 full-time employees. What is the participation requirement?
Yes.
No, we don't have a participation requirement as long as you meet the state eligibility requirement.
Okay. And then Sue's also asking. She says she doesn't quite understand how your company gets paid. Can you explain that?
Right. Our company gets paid. Remember, at the end of the month, you've saved about $60 per participant. We're going to bill you $30. That's how we.
Sue, does that answer your question for you?
And that way, you actually you end up saving $30 of the $60.
What do you see as the biggest concern with people going into something like this? Is it because it's something new and different?
We have found that's a great question. What we see this as the future of healthcare in the United States. It's fundamentally changing everything. So anytime you have something that is going to create a fundamental change, there's a slight hurdle. But
Sure.
What we have, we've gone to extreme measures to make sure that we've got all of our program, all the I's dotted, all the T's crossed, and so forth. But as far as obstacles, no cost is irresistible. I mean, there really is, it really does make things irresistible. And our objective is to help as many people as we can with this program. So as far as hurdles, we really haven't seen that many, as far as just because it's new. The only time we ever see, we ever have hurdles are folks, unfortunately, it does require 50 full-time employees. And there's a lot of companies out there that I wish we could help that don't have enough employees to be eligible.
Okay. And Tony's asking, he says, I have 1,000 employees. How much is the check I write to get the program started?
Well, there's no setup fee. That's the great thing.
There's no setup fee. Okay.
Yeah, there's no setup fee at all.
When would be the first payment that would be due? Is that once everybody's enrolled and that's 30 days after, I imagine?
Yeah, we bill in arrears just like any other healthcare firm.
Okay, Kevin says, I have 20 people plus in the States coming on and off payroll all the time. How do we manage who is in and who is not participating, and who are we paying for monthly?
Well, that's a great question. I'm gonna answer the question. Unfortunately, remember that it does require 50 full-time employees in your company, but that's still a great question. And how we work, and this is the great thing about being a nonprofit, our nonprofit, is that even if an employee, let's say an employee normally works 25 hours a week and they're on the program, all right, If they go for up to 3 weeks in a row under that 20 hours, right? They're not, so where they're not qualifying, we do not remove them from the program. They get to stay in the program. And then the other great thing is that once they come back and they start working the 25 hours again, there's no catch-up payments. There's no makeup fees or anything like that. The only thing is that if they go at more than 3 payrolls in a row, they would have to drop back to the limited program, which does not include the minimum essential care. Remember, because all the employees get the telehealth and the wellness at no cost. But 3 weeks. I mean, that's a long time. That's a long time to go without making the hours, the average number of hours. So what we try to do at the beginning, Jamie, is we look at the census of the company, and then we can determine, the average number of hours that each employees are working, which helps out a lot.
Okay. And just to be clear, Kevin's actually said he has thousands of employees across 20 different states, so more than 20.
Okay. Well, then you're eligible for sure.
Yeah. And so, okay. And then I have another question. What, if any, are IRS implications, audits, et cetera? Is there anything like that we would have to foresee in being a part of this plan?
No, not at all. I mean, we've never had any, number one, but number two is that, because when this 105B program came out, we wanted to distinguish ourselves and separate ourselves as far from it as we could. So we actually have an all clear letter from a former chief counsel of the Internal Revenue Service. And we also, all our plan documents are done by the Groom Law Group, which is really considered the #1 ERISA and healthcare law firm in the country. In fact, they were instrumental in architecting the ACA.
Oh, wow. Great. Keep your questions coming. See people typing. Who is the third-party administrator?
Worksite HR is the third-party administrator.
Worksite HR, okay. And how long has this program been in fruition?
This program has been out for about 3 years. We've been in business since 2013, but this program specifically has been out about 3 years.
And then how long does it take to set up the program?
Well, my IT team will not like this answer, but we can get it going in a week.
Okay, perfect. IT departments never like our answers.
No, they would prefer me to say 6 weeks.
Yeah.
But no, we can do it in a week.
Can it be added outside of open enrollment?
It can, yes.
That's great.
Great question.
Sorry, I'm waiting for other people's questions
to come in. That's okay.
What would you say is if somebody wanted to get started, what's the next steps?
Really simple. Just all they have to do is just reach out to us, and we'll ask them for a census, gather their information, and start putting a proposal and program together. We can usually get that done in as little as a day or two, and then we'll get it out to them. And basically from there, it's just a matter of signing plan documents and starting implementation. It's very similar to any other healthcare program, the process and so forth. Basically, census, quote, and information. Except our quote is always going to be 0. So.
And what if somebody's actually asking, can you go over again as to how this is a no-cost program? Yes,
absolutely. I'm happy to. Again, I'll refer back to the example that I gave, which is it usually makes it a little bit clearer. So if you have an employee who's making $1,000 a week, they're taxed on that entire $1,000, of course, payroll taxes, right? Now, if you have a Section 125 program such as ours, that program is pre-tax, right? So which means that obviously there's not going to be any taxation on whatever that premium is. So if the premium happens to be $200, that is usually going to give that employee a tax savings of about $30, okay? Some of that is going to come from Social Security and Medicare, which is a shared tax. And that becomes important later, all right? But if there's a $200 premium deduction and there's a $30 tax savings, well, the employee's still at $170. Well, how do we make that employee whole, all right? The way we do that is that Once the TPA, Worksite HR, receives the funds from the employer for the premiums, we pay Extension Health. Extension Health is the nonprofit, right? And this is very important. Extension Health then takes a chunk of that premium, what we paid them, and sends it back to the employer for distribution to the employee as a charitable donation. Okay, that amount is usually around $180. So here's the magic, so to speak, is that $180 plus the $30 is $210. Right? The employee's premium deduction was $200. Okay. Now remember, because that donation is tax-free, they're going to net out that additional $10. So their check increases by $10 and they're receiving free healthcare. Right? Now on the employer side, remember that $15 of Social Security and Medicare that the employee saved? Well, that's also saved by the employer now, because remember, it's a shared tax. Okay, so that's about $60. That's weekly. That's about $60 a month. Okay, so 15 times 4, of course. All right. So now we have an employee who's gotten free healthcare, and we have an employer who's saved $60 a month on their Social Security and Medicare payroll taxes. All right. We bill them $30 per participant, right? Which nets the employer $30, nets the employer $30 savings as well. So with those examples, like the 1,000 employees, that's where I was saying that there's a $30,000 a month net savings to the employer in payroll taxes.
Okay. I have another question from Jared. It says, what if you have 50 full-time employees upon starting the program, but then fall below that number due to unforeseen circumstances, example, COVID?
Yeah, no, that's a good question, and they're allowed to stay on the program. Yeah.
Okay. And is it once you have your 50 enrolled, you're on until you continuously hit for a period of time with not that many employees? Is that
you're on for the whole plan year? Yeah.
Okay.
At the end of the plan year, and I'll be interested to see what some of the states decide is the threshold now because of COVID, whether it comes below 50. I think there are a couple states. I think Colorado actually is 30. There may be states there too.
So Florida is definitely 50.
Yes. Okay.
And then Bill asks, how does the relationship work with a current insurance agent that has the major medical plan in place?
Well, we're a TPA, so we just like a carrier. We work with agents. We work with all agents.
That's awesome.
Yeah.
Kobe would like to know, will there be a burden on the staff for ongoing calls from employees about the program enrollments, waivers, etc.?
No, not at all. We have a call center that's bilingual that handles all the calls, information about the program, enrollment, everything.
Okay. And then Kevin's asking, is there ever a scenario where the company is paying something to you but not getting funding back to cover an expense?
No.
Kobe's asking, what participation do you see on a group, let's say, with 1,000 eligible employees?
Well, 1,000 eligibles, I mean, you're usually talking about 90% of the employees would prefer our program, especially in the staffing industry. Now, those other 10% are usually like staff that you would want to have a major medical program that has hospitalization. They can afford it. All right. Now, even those 10% will often, as we spoke about before, will often take our program as well because they know it's not going to cost them anything additional. Plus, it really eliminates them having to come out of pocket to meet their deductible. What we typically see as far as retention is about 85%. Unfortunately, there's still that, you can bring a horse to water, but you can't make it drink, because some employees, just for whatever reason, they'll decide they don't want to be on the program. All right. We actually give them 60 days to opt out of the program once they're on it.
Okay. Is the program available in every state?
Yes.
Okay. And how are our employees enrolled?
The employees, we typically do it two ways. A lot of our clients choose to have all the eligibles auto-enrolled in the program, and then they are given 60 days to opt out. Some of the companies prefer to go the traditional route, where they actively enroll in the program. They can either log on to our portal, they can call our call center, or last resort is paper enrollment.
No more paper. I think one of the things that I've seen that's really cool about the program is the Teledocs program. I've used a very similar product before in the past. But that also, you did mention that it allows your family to have access even though they're not covered under healthcare. Is that correct?
Absolutely, yes.
It's a great benefit.
Yes, definitely is. Future of healthcare.
Yes. One of the things that you mentioned when we first met, John, was that healthcare costs were expected to go up next year. Can you elaborate a little bit on what that is what we're expected to see?
Yes, I mean, not only do we have the natural increase in healthcare that we've been seeing for the last few years, but unfortunately, the COVID pandemic is wreaking havoc. It's not just about the number of people who get it. It's about the projections and the fear, and that's what insurance carriers base their premiums on, are the projected numbers, and it's a pretty scary future.
Jared's asking, you mentioned that the plan is attached to a charity. Can we choose the charity, or is that set through you guys because it's based off of the account that's created?
Well, if the charity is actually one of the companies providing services, all right. So that's Extension Health. So Extension Health is providing the wellness services. So in this case, you would not be able to choose the provider because they're the wellness provider. All right.
Is there a benefit for any employees that don't work enough hours to be eligible? And for example, an employee working only 10 hours a week?
Yes, as I mentioned, this is a fantastic part of the program, is that even those employees that are only working 5 or 10 hours or whatever still have free access to the telehealth and the wellness. The only part of the program that they would not have access to would be the minimum essential care element. But the telehealth, which to me really, and as you mentioned, is the most important part of the program, they still have free access to, regardless of the number of hours.
I have another question. So if I have 1,000 employees, should I expect an annual savings of $300,000 or more per year? If so, how is that possible?
Yes, that is what you should expect. It's just simply the numbers. It's a Section 125 program, and you're saving about $30 a month in taxes because of that Section 125 program. Remember, these programs have been around since 1974. And really, to get a little off topic, every insurance company out there could do what we do. They really could. But they choose not to, simply because they market to a different demographic. They market to a demographic that can afford major medical insurance. But look at the participation on your programs of people who take the major medical. It's very small. It's very small because there are so many people out there that are going without insurance. And the reason is because they cannot afford it, right? So we have chosen to market and help a demographic that has been largely ignored by the healthcare system. And that's why it's possible.
Okay. Do you work in other industries other than staffing?
Absolutely. Staffing is a very, very popular industry for us. Agriculture, another very popular industry. Security guards, the restaurant industry is huge, and that's why, I just had an article published in QSR magazine that they'll be able to find on the website too, which talks about how we're helping the restaurant industry as well.
And then Kevin would like to know, how do we follow up with you to talk about and walk through the specifics of our situation about moving forward?
Actually, you guys can contact me directly. Jim, you'll provide my contact information. Yes, everybody in staffing in this staffing association, follow up with me directly, and I'm happy to help you and guide you.
Yeah, one thing I will tell everybody that we will send out to you the slides for today, so you will receive those. And if you are a member of the Florida Staffing Association and you have the ability to log in and review the video as well, once it's been uploaded to the system. We do have another question from Tony. It says, what happens if the employee works for more than one staffing agency?
Well,
Happens a lot.
yeah, that's true. Well, you know, the only way we could do it is they're only allowed to have the one program, right? I mean, they can only have one program. So, I guess we would have to see which staffing agency got to them first. I don't know. Because the employee would make that choice on where they wanted their deduction coming from.
Maybe it could be where they were working up for the most hours. Could be.
Yeah.
But I could see how it could also switch between staffing agencies where it's, one week they're with this company and the next week they're with another. So.
Yeah, we actually have that issue sometimes with like large conglomerates who have maybe, multiple companies within them, and then the managers fight over, because they're looked at, they're on their budgets, so the managers fight over who gets to do the deduction. So it's kind of funny sometimes.
They want the credit.
Right.
Perfect. Any additional questions anybody has, please feel free to go ahead and put them in the chat box. We do have a few minutes left to be able to get those questions answered. How do we explain this program to our employees?
Well, we help you. We definitely help you. Not only do we provide, all the literature and so forth, but we are also happy to do webinars, conference calls with your employees. One of the things that works very well is with webinars with regional managers who we train to be able to champion the product to the employees.
What do you see the biggest question is from the employee side?
The biggest question from the employee side is basically is how do I use my benefits? And I think that isn't really just with our program. It's with any program. It's very important. That's one of the things I was going to comment also, is that's why our call center is English and Spanish, because a lot of times, if something is not presented in the person's native language, they never take advantage of the program. All right. And in this case, this is completely different than what the other carriers want. The other carriers want utilization to be low. Well, we want utilization to be high. All right. We're a nonprofit. That's our job. So definitely we'll be integral in assisting them.
Okay. Kobe's asking, what is the setup for the pre-tax deduction and subsidy back to the employee on payroll? How do we set up a pre-tax deduction?
Once a company comes on board with us, we assign them an implementation manager, and the implementation manager walks them through the entire process step by step. Yeah, which is actually fairly simple. It's just your premium deduction is your premium deduction, and then there's just another line item to add in the subsidy.
Is the subsidy given a separate check or done at the same time as payroll?
Same time, same check.
Awesome.
Okay.
Got people typing, sorry.
Okay.
Why wouldn't somebody want this program?
It's the future of healthcare in the U.S., so I don't know.
I think the only thing I can think of is something new and not really understanding the facts. I mean, as many people that have worked in HR and staffing for years, you hear about the same thing with insurance. It's something new, and I think that a lot of it's just better understanding it. And I'm pretty sure that many people will be having several questions following this webinar, so we'll definitely be reaching out to that. Does anybody else have any other questions that they would like to add? What about laid off employees? That's
a great question. We didn't do this. I'll be honest. We didn't do this until COVID started. But ever since COVID, we've been providing the telehealth and wellness, the same as we do for those employees that don't work enough hours, for 60 days after termination or being laid off at no cost.
Okay. And then what would the employees, who would the employees contact with the questions that they might have? Do you guys have a call center?
Yes, we have a bilingual call center that they can call for any questions related to the program, the subsidy, the deduction, everything. And now, not only that, but just so folks know, is that even if we are not your broker on your major medical, they can still use we have a full ERP system, so we have a benefits administration platform. They can use that platform even to administer benefits that we're not the broker on.
Okay.
And we also do we're also certified by the Internal Revenue Service to do the ACA filing at the end of the year as well, which we do for our clients at no additional charge.
That's a great benefit.
Yeah, I'm glad. Thank you for asking questions.
Add that one to your slide for sure.
Right.
Is your call center, is that, do you have multiple call centers throughout the U.S. or do you cover both to all time zones?
We cover all time zones.
Okay. Just to clarify, there are no out-of-pocket costs.
The only out-of-pocket cost is the copay for the minimum essential care. There's no copay for the telehealth or the wellness, of course, but it's just if you see a general practitioner, it's $20. A specialist is $40.
Okay, and I think he's referring to more the employer.
Employer, no. No cost for the employer.
Yeah.
In fact, remember the employer is going to save that $30 a month per participant. Yeah, one of the things that we're telling especially in the restaurant industry is because they're having such a hard time getting back, is that these dollars, the same as the president had intended, these payroll tax savings dollars can be used for that recovery, can be used to recoup those losses. So I mean there's different ways to look at it. I mean, you're either recouping losses or you're preparing for the future. But definitely want to take employers. We definitely want employers to take advantage of this.
Okay, I have a question from Howard here. It says, what if additional services like a cortisone shot at an office, will the doctor bill me directly?
Well, it depends on the doctor. What we do with the doctors there is we also do the patient advocacy for you.
Okay.
All right. So what we try to tell the doctors is that, hey, look, bill this as a visit. If you do the cortisone shot, just include it as part of the visit and we pay for it. Because if they make them come back and they do it separately or they send them out to the lab, they'll still get a discount, but there'll be some cost to the employee. So we encourage the doctors to do everything in office so that it's completely covered.
Is that something that we would have to explain to the employees, or is that something that the doctors are kind of already been informed?
Yeah, we explain it to the doctors too. These are all great.
These are great questions. Yeah, I'm glad we left a lot of time open for questions.
Yeah.
Any additional questions we have? We have a couple more minutes left. Bill says, really good, thank you.
Thank you.
Okay, I guess if there's no additional questions, we will let you guys get back to your day. I just want to say thank you very much on behalf of the Florida Staffing Association for joining us today. And we will be sure to get this information out to you so that you can reach out to Dr. John and be able to potentially move forward with this program. I'm excited about the future of staffing in this program and what it can do for each of our agencies. So be sure to check out the Florida Staffing Association website for upcoming webinars. We are doing them every week, so please sure to check those out. Thank you guys all for your great questions, and a special thank you to John for joining us today. Have a great day.
Thanks, everyone.
Have a great day.
Bye all.
Bye-bye.